Hi, hello friends, good morning. Welcome to our channel, The Voice of Nurse. Today we are going to discuss third model paper for staff nurses 2023 exam purpose. This is part 3. This is continuous topic from the previous classes. We already finished two parts related to the third set of model paper. In part 1, first to 30 questions, and part 2 regarding third model paper is our last class. In part 2 we discuss related to the third model paper questions 31 to 60 questions. Till now we finished 60 questions in third model paper, third set of model paper. In today's class we will finish with third set of model paper. Previously we finished two sets of model papers with explanation done. Approximately we finished 90% of nursing subject. Also subject wise we discussed related to the FAQs, frequently asked questions, and very important question we finished. Before today's class discussion, a small review friends regarding syllabus. What we finished till now, we have to review first of all. Anatomy and physiology, microbiology, fundamentals of nursing, first aid, community health nursing, nutrition, medical surgical nursing, sociology, midwifery and gynecological nursing, child health nursing, mental health nursing. These all subjects. Till now we finished one set of all subjects, very important, and FAQs, previous years FAQs, very important question plus frequently asked question in previous years. Till now these all are subjects we discussed in previous classes related to the anatomy and physiology, microbiology, fundamentals of nursing, first aid, community health nursing, nutrition. We finished each subject 100 questions. Approximately we discussed 1500 to 2000 questions. 1500 to 2000 questions we discussed in previous classes. Anybody here new to channel, please check it once friends. Each and every question very important to everyone, because why I am mentioning repeat and repeat repeatedly, I am mentioning these all are the subjects review means. Why? Because recently we got a mock test question paper for practice purpose. We got a mock test for CBT practice purpose from the MHSRB. For that question paper also, so many repeated questions from the our subjects. So many repeated questions we already discussed in our subject previously. Previous classes we discussed subject wise, all subjects we discussed. Approximately 20 to 30 questions we got a repeated questions. Why? Because we already discussed in previous classes. That's why I am mentioning. If you people have any doubt related to the mock test also, please check it once my previous classes. All things approximately 30 questions, 25 to 30 questions already we discussed in previous classes. Not only these subjects we finished related to the CPR, cardiopulmonary resuscitation, NHM solved papers, two sets of NHM solved papers, model papers, two sets we already finished. Now we are moving on third model paper. Today's class we are going to discuss third set of model paper part 3. After finishing this class, today's part 3 related to the third part and third set. 3 sets we will finish today's class. After finishing this class, we are going to discuss, after finishing today's class, next upcoming classes, we are going to discuss TSMHSRB staff nurse mock test question paper with explanation. I will take a class. In upcoming classes, we will discuss mock test. Till now we finished these many subjects, these many topics, and approximately 1500 to 2000 questions we already successfully finished. Today we are going to discuss third set of model paper for staff nurses exam purpose 2023, and part 3 we are going to discuss today's class. In part 3 we are going to discuss 61 to 100 questions. 40 question in today's class we are going to discuss with explanation. Before moving on to topic, anybody here new to the channel, please subscribe my channel and watch the video till the end, and please subscribe my channel, click on the bell icon for further notification, and share your opinion in comment section. Please share the video to your friends and you can ask any doubt in comment section also. Let's move on to today's topic, third part of third model paper, third set of model paper part 3. From 61 to 100 question we are going to discuss today's class. Question number 61. Which of the following formula is used to calculate the dose of a medicine for a children's? From the following formulas, which we can use to calculate the dose of a medicine for a children's? We will see here options. First, option A, Friend's rule. Option B, Young's rule. Option C, Chark rule. Option D, all of the above. Proper dosing of pediatric medicines depends on the factors such as age, weight, overall health status, physiological functions, and stage of development of body systems for drug metabolism. Pediatrics means the branch of medicine that deals with the disease in children from birth through adolescence. So here the proper dosing of pediatric medicine is depending upon the age, weight, overall health status, physiological functions, and development of body systems. Actually we are having so many formulas to calculate a dose, formula to use it to calculate the dose medicine for the children. For example, Evans formula, Chark's rule, Young's rule, Friend's rule. These all are the some types of formulas to use calculate the dose of a medicine for a child. Evans formula, I am mentioning clearly, Evans formula is used by resuscitation formula instructed for patients with severe burn injury. This is based on the body surface area damaged and body weight. This is related to the Burns formula. Evans formula is calculating the drug in case of burns. Young's formula, calculate drug doses using the children's age in 1 year. In exam, calculation of pediatric doses of medication for children under age of 1 year. Which formula we can use means here we have to give answer Trent's rule. Here in this question, which of the following formula used to calculate dose of medicine for the children's means all of the above is the correct answer. Here Friend's rule, Young's rule, and Chark's rule. Not only these rules, we are having additionally Dilling formula also. So these all are the formulas related to the calculation of drug dose in the children's. Next we will move on to question number 62. A client with fat malabsorption is at risk for which of the following? Here the client is having fat malabsorption. The client is having risk for following. Which of the following? We will see here options. Option A, constipation. Option B, type 2 diabetes mellitus. Option C, oxalate kidney stones. Option D, vitamin deficiency. When large amounts of unabsorbed fat are available, calcium preferentially binds to fat instead of oxalate. This leaves oxalate available to easily reabsorb by the colon, ends up into the urinary tract. Some symptoms such as fatty stools and chronic diarrhea are evident, anemia and muscle wasting. Dehydration and malabsorption can both lead to kidney stones. Both of these problems can cause it by gastrointestinal issues including chronic diarrhea. The results of this study support the concept the severe malabsorption of dietary fat plays a primary causative role in enteric hyperoxaluria. When the large amounts of unabsorbed fat are available, calcium preferably binds to the oxalate. So here oxalate kidney stones. Here the client with malabsorption, fat malabsorption, risk for the oxalate kidney stones. So here in these options, option C is the correct answer. Next we will move on to question number 63. Which of the following is not an essential amino acid? From the following, which is not an essential amino acid? We will see here options. Option A, leucine. Option B, methionine. Option C, arginine. Option D, valine. Is meant by amino acids. Amino acids are known as the building blocks of protein and they are required in muscle building, tissue repair. The essential amino acids cannot be made by the body, so they must come from food. There is a total number of amino acids or 20. 9 are called as essential amino acids and 11 is called as non-essential amino acids. Actually, we are having 20 amino acids totally. In 20 amino acids, we are having 9 essential amino acids and 11 are the non-essential amino acids. 9 essential amino acids are, just write down friends, histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan and valine. These all are the essential amino acids. What are the non-essential amino acids? Means 11 non-essential amino acids. Those are alanine, arginine, asparagine, asparic acid, cysteine, glutamic acid, glutamine, glycine, proline, serine and tyrosine. So here we got a non-essential amino acid is arginine. Arginine is present in 11 non-essential amino acids. One of the non-essential amino acid is arginine. So here leucine, methionine, valine, these all are the essential amino acids. So here in these options, option C, arginine is non-essential amino acid. So here option C is the correct answer. Next we will move on to question number 64. What is the meaning of costa? C-O-S-T-A. What is the meaning of costa? We will see here options. Option A, bile ducts. Option B, cartilage. Option C, rib. Option D, colon. Costa is a rib or rib-like part, such as the midrib of a leaf or a thickened anterior vein or margin of the insect wing. Any of the 12 pairs of curved arches of bone extending from the spine to or toward the sternum in humans. Rod-shaped intracellular organelles lining below the undulating membrane of trichomonas. This is the medical term meaning for the costa. So here in these options, option C, costa means option C, rib is the correct answer here. Next we will move on to question number 65. Korsakoff's psychosis is due to intake of. What is the cause for the Korsakoff's psychosis? We will see here options. Option A, alcohol. Option B, opium. Option C, A and B. Option D, none of the above. Korsakoff syndrome is also known as Korsakoff amnesic syndrome. Is a memory disorder that results from vitamin B1 deficiency and associated with alcoholism. Korsakoff syndrome damages nerve cells and supporting cells in the brain and spinal cord, as well as the part of the brain involved with memory. Commonly caused by the alcohol misuse, but can also associated with AIDS, cancers that have spread throughout the body, chronic infections, poor nutrition and certain other conditions. It is also common in people whose bodies do not absorb food properly. Means malabsorption also one of the cause. What is meant by Korsakoff psychosis? It is a late complication of persistent encephalopathy and result in memory deficit, confusion and behavior changes due to the excessive alcoholism. So here in these options, this is due to the Korsakoff psychosis is due to the intake of alcohol. So here in these options, option A is the correct answer here. Next we will move on to question number 66. While assessing the client, the nurse identified blue discoloration of the vulva and vaginal mucosa. It can indicate too. Here, while assessing the client, the nurse is identified the vulva and vaginal mucosa was blue discoloration. It indicates to which of the following? We will see here options first. Option A, Jacquemer sign. Option B, Chadwick sign. Option C, A and B. Option D, none of the above. It is a non-specific early sign of pregnancy that is typically characterized by bluish discoloration of the cervix, vagina and vulva. The Chadwick sign usually presents 6 to 8 weeks after conception and commonly disappears shortly after the birth. Chadwick sign is a bluish discoloration or violet discoloration of the cervix, vagina and labia resulting from the increased blood flow. Chadwick sign is also known as Jacquemer sign. Chadwick sign or Jacquemer sign is one of the several changes that can indicate you or likely pregnant. It is observed between the 6 to 8 weeks after the conception. So here in these options, option A and B both is the correct answer, because other name for the Chadwick sign is Jacquemer sign. So here blue or violet discoloration of vulva and vagina and also cervix is indicates to Chadwick sign or Jacquemer sign. So here option A and B. So option C is the correct answer here. Next we will move on to question number 67. During the first several hours after a cardiac catheterization, the nurse have to monitor. Here the client is having post-cardiac catheterization. First several hours after the cardiac catheterization, the nurse have to monitor. We will see here options. Option A, elevate client bed at 45 degrees angle. Option B, frequently monitor client apical pulse and blood pressure. Option C, monitor client's temperature hourly. Option D, all of the above. After the procedure, patient may be taken to the recovery room for the observation or any ICU, post anesthetic or post cardiac ICUs. They will remain flat in bed for several hours after the procedure. A nurse have to monitor vital signs, insertion site, circulation or sensation in the affected leg or arm. Or should monitor after cardiac catheterization, heart rate and rhythm, respiratory and pulse rates, blood pressure frequently have to monitor. Monitor the patient vital signs every 15 minutes for second hourly after the procedure, every 30 minutes for the next 2 hours. So here the nurse have to monitor hematoma also, because post of the procedure the complication seen after the cardiac catheterization, this is the most common complication is hematoma. So nurse have to monitor hematoma also. But here the first several hours after the cardiac catheterization, the nurse have to monitor, frequently monitoring clients apical pulse and blood pressure, heart rate and rhythm. These all things nurse have to monitor. So here option B is the correct answer. Next we will move on to question number 68. Abdominal protrusion of an organ through a weakness in abdomen. Abnormal protrusion of an organ through the weakness in abdomen is which of the following condition? We will see here options. Option A, adhesion. Option B, hernia. Option C, edema. Option D, valvulus. A hernia occurs when an organ protrudes through the wall of muscle that encircles it. There are several different types of hernias that can occur in the abdominal and surrounding areas. These includes umbilical hernias, epigastric hernias, incisional hernia and others. Abdominal hernia, protrusion of the abnormal abdomen area, means here hernia refers to any protrusion of intestine or other tissue through a weakness or gap in the abdominal wall. Hernia is the protrusion of organs such as intestines through a weakened section of the abdominal wall. If left untreated, the split in the muscle wides and greater amounts of tissue or organs are pushed through the opening, forming a sac. This visible lump or bulge is one of the key characteristics of a hernia. So here the abnormal protrusion of an organ through a weakness in abdominal wall is called as hernia. So here in these options, option B is the correct answer. Next we will move on to question number 69. Which bone forms the forehead? Which bone can form a forehead? We will see here options. Option A, occipital. Option B, temporal. Option C, frontal. Option D, parietal. Within the cranium. The frontal bone connects with the ethmoid bone inferiorly and medially, posteriorly and inferiorly. The frontal bone meets the sphenoidal bone. As the frontal bone ascends posteriorly and laterally, it will meet the temporal bone. Then finally parietal bone at the top of the skull. The glabella, the part of the os frontal that lies between the eyebrows, ends at the top of the nasal bone. The frontal bone is thicker at the eyebrows, and this is usually more pronounced in male skull. Where nasal bones and glabella meet is called as nasation. This dip is easy to see and feel. Does the frontal bone form the forehead means skull of the cranium and frontal bones forms the forehead. The cranial floor consists of the sphenoid and ethmoid bones. So here which bone form a forehead means here in these options. Option C, frontal bone is the correct answer here. Frontal bone is a unpaired shell-shaped bone that forms the anterior superior accept of the cranium. It consists of four parts: squamous, orbital and nasal. Orbital is two orbitals, squamous is one, nasal is one. So here four parts in the anterior superior aspects of the cranium. So here in these options, option C, frontal bone, which bone is forms a forehead means frontal bone is the correct answer. Next we'll move on to question number 70. Which part of the brain controls the heart? Which part from the following options, which part of the brain will control the heart? We will see here options. Option A, neuron. Option B, medulla oblongata. Option C, cerebrum. Option D, spinal cord. The brain stem sits beneath the cerebrum in front of the cerebellum. It connects the brain to the spinal cord and controls automatic functions such as breathing, digestion, heart rate and blood pressure. Brain controls the heart directly through the sympathetic and parasympathetic branches of the autonomic nervous system, which consist of multisynaptic pathways from myocardial cells back to peripheral ganglionic neurons and further to central preganglionic and premotor neurons. Medulla oblongata controls breathing, blood pressure, heart rhythms and swallowing. Messages from the cortex to the spinal cord and nerves that branches from the spinal cord are sent through the pons and the brain stream. So here which part of the brain controls the heart means here in these options, option B, medulla oblongata is the correct answer. Next we will move on to question number 71. From the following, which one is a developmental stage corresponds to infancy? Here in these options, from the following options, which one is a developmental stage corresponds to infancy? We will see here options. Option A, trust and guilt. Option B, autonomy and shy. Option C, trust and mistrust. Option D, initiative and inferiority. The trust versus mistrust stage is the first stage of psychologist Erikson's theory of psychosocial developmental. This stage begins at birth and lasts until a child is around 18 months old. Here the stage is trust versus mistrust in infancy. The first of Erikson's 8 stages of psychosocial development between birth and 18 months of age. During this stage, infant either comes to view other people and himself or herself as trustworthy, or comes to develop fundamental distrust of his or her environment. So here one of the developmental stage corresponds to infancy means here option C is the correct answer, trust and mistrust. Next we will move on to question number 72. Which of the following is the best method to confirm a placement of NG tube? Here in these options, following option, best method to confirm a placement of nasogastric tube. We will see here options. First, option A, aspiration of gastric tube. Option B, auscultation. Option C, X-ray. chest. Option D, ask patient about comfort. The radiographic confirmation of NG tube placement, the gold standard for nasogastric feeding tube placement is radiographic confirmation with a chest X-ray. Taking an abdominal X-ray is the best way to confirm the location of the tube, even if there is the aspiration of gastric content, as the tube may be placed past the pylorus, where it will be aspirate not just gastric secretions but also hepatobiliary secretions, leading to persistently high output. And auscultation is most often used at the bedside to check appropriate placement of nasogastric tube. Sound generated by air blown through the tube is used to determine tube placement in the gastrointestinal tract. But placement of NG tubes is always confirmed with an X-ray prior to use. This is best and golden standard for the NG tube placement. So here in these options, option C is the correct answer, X-ray chest. Next we will move on to question number 73. Piscasex sign means. What is meant by Piscasex sign? We will see here options. Option A, asymmetrical enlargement of uterus. Option B, symmetrical enlargement of uterus. Option C, uterine contractions. Option D, all of the above. In lateral implantation, there is a asymmetrical enlargement of the uterus. One half of the uterus where the implantation occurred is the firm, while the other half it is soft. This is known as Piscasex sign. This sign is named after Ludwig Piscasex. But Piscasex sign means focal uterine softening, characteristics of early pregnancy, is usually known as Piscasex sign or von Braun-Fernwald sign, but should be attributed to Robert Lawton Discosan, first described in 1982. The presence or absence of Discosan sign was carefully noted in 1040 pregnant patients seeking abortions. Here the Piscasex sign means asymmetrical, that the uterus presents in a gynecological physical exam. We can identify in physical exam. It is a asymmetrical enlargement of the uterus. So here in these options, option A is the correct answer. Piscasex sign means asymmetrical enlargement of the uterus. So here in this option, option A only correct answer. Next we will move on to question number 74. Which part of the scapula articulates with humerus? Here in these options, which part of the scapula can articulate with the humerus? We will see here options. Option A, clavicle. Option B, acronym. Option C, glenoid cavity. Option D, none of the above. The lateral angle of the scapula is the location of the glenoid cavity. This is where the humeral head articulates with the scapula. Is glenoid cavity. Glenoid cavity is a shallow depression at the lateral apex of each scapula, articulates with the head of the humerus, means upper arm bone, to form the shoulder joint. Overhanging the glenoid cavity is a projection known as the coracoid process. The head of the humerus is proximal articular surface of the upper extremity, which is an irregular hemisphere. It articulates with the glenoid fossa of the scapula. The scapula is also known as shoulder blade. Scapula articulates with the humerus at the glenoid fossa and the clavicle at the acromion process. So here which part of the scapula articulates with the humerus means here option C, glenoid cavity. Glenoid cavity. Scapula is articulates with the humerus at the glenoid cavity. So here in these options, option C is the correct answer. Next we will move on to question number 75. Which of the following diseases is airborne disease? Which of the following disease from the following option, which disease is airborne disease? We will see here options. Option A, acute poliomyelitis. Option B, viral conjunctivitis. Option C, A and B. Option D, measles. See one by one. Acute poliomyelitis. Acute poliomyelitis is a disease of the anterior horn motor neurons of the spinal cord and brainstem caused by the poliovirus. So, due to the loss of motor neurons and denervation of their associated skeletal muscles, due to these causes acute poliomyelitis will happen. Next we will see viral conjunctivitis mode of transmission. Most of the cases and common causes conjunctivitis spread through the hand to eye contact by hands or objects that are contaminated with the infectious virus. Having contact with infectious tears, eye discharges, fecal matter or respiratory discharges can contaminate hands. So direct contact or objects that are contaminated with the infectious virus, this is the mode of transmission for the viral conjunctivitis. So here option C, A and B is there, option D measles except here. So here which of the following disease is airborne disease means measles, option D is the airborne disease here. We'll see regarding measles. Measles is a highly contagious serious airborne disease caused by a virus that can lead to a severe complications and death. Measles vaccination averted 56 million deaths begin between 2000 and 2021. Measles is the virus is transmitted by direct contact with infectious droplets by or airborne spread when an infected person breathes, cough or sneezes. So measles is the airborne disease. Here in these options, option D is the correct answer. Next we will move on to question number 76. After stops a patient's breathing, brain damage might happen. Here the patient is stopped breathing. The brain damage might happen after stopping breathing, means how much the duration between. We will see here options. Option A 8 minutes, option B 10 minutes, option C 2 minutes, option D 4 minutes. The time is very important when an unconscious person is not breathing. Permanent brain damage begins after only 4 minutes without oxygen and death can occur as soon as 4 to 6 minutes later. It is a medical emergency that can happen from many events where oxygen to the brain may be cut off, such as from the conditions like drowning, choking, suffocation, cardiac arrest or head injury. Cerebral hypoxia can kill brain cells and lead to brain damage and death. So here after stops a patient's breathing, the brain damage might be happen, means here option D 4 minutes is the correct answer. The permanent brain damage begins after the 4 minutes, only 4 minutes without oxygen, and death can occur as soon as 4 to 6 minutes later. So here if we seen one person is not breathing, means not only clients, in case any person is suddenly absence of breathing, there is no breathing cessation of breathing, so immediately we have to give a rescue breaths. There is no pulse, means immediately we have to start a CPR. Yes, there is pulse, there is no breathing, means we have to give only rescue breaths. Otherwise there is patient is taking breathing, there is no pulse, means immediately we have to start a CPR. But here in this question related to the breathing and brain damage, means here the client stops breathing, brain damage might happen within 4 minutes. So here option D is the correct answer. Next we will move on to question number 77. Other name of erythema toxicum. What is the other name for the erythema toxicum? We will see here options. Option A redness, option B erythema, option C lethargy, option D newborn rash. Erythema toxicum neonatum, also called as erythema toxicum. It is a benign self-limited transient evanescent eruption that occurs approximately 48% to 72% of full-term infants. Erythema toxicum is a common benign skin condition in healthy newborns. That lesions are characterized by multiple erythematous macules and papules ranging from 1 to 4 mm that rapidly progresses to pustules on the erythematous base. It is a common newborn rash. It is not a serious, does not cause the baby any harm and clears up without any treatment up to 7 to 14 days. It can clear. It is also sometimes known as erythematoxicum or erythematoxicum neonatum and baby acne or toxic erythema of the newborn, and also known as newborn rash. Here other name of the erythematoxicum is option D, newborn rash. Option D is the correct answer here. Next we will move on to question number 78. Inability to balance the extraocular muscles is called as. Inability to balance or uncontrolled extraocular muscles is called as. We will see here options. Option A, cataract. Option B, strabismus. Option C, nystagmus. Option D, none of the above. Here involuntary or inability to balance the extraocular muscles, here having rapid involuntary movements of the eyes most common in this condition. Nystagmus is a vision condition in which the eyes make repetitive uncontrolled movements. These movements often result in reduced vision and depth perception and can affect balance and coordination. These involuntary eye movements can occur from side to side, up and down in circular pattern also. Word nystagmus is also termed as uncontrollable movements of the eyes that may be side to side, means horizontal nystagmus, up and down it means vertical nystagmus, means circular movement means rotatory or torsional nystagmus. These all are the types of nystagmus. Main cause for the inability to balance the extraocular muscles: retina or optic nerve disorders, inner ear conditions, stroke, head trauma, disease of central nervous system, albinism, multiple sclerosis, undeveloped control over eye movements. These all are the common causes and risk factors includes nystagmus. Inability to balance the extraocular muscles is called as nystagmus. So here in these options, option C is the correct answer. Next we will move on to question number 79. During the ECT, electroconvulsive therapy, electrodes placed at which region? Here during the ACT procedure, electrodes will placed at the which region? We will see here options. Option A, occipital. Option B, parietal. Option C, temporal. Option D, all of the above. Besides traditional bilateral and right unilateral placements, ECT electrode placement includes bifrontal and left anterior right temporal. What is meant by ECT? ECT, electroconvulsive therapy, is a medical procedure that involves passing a mild electric current through your brain, causing a short seizure. This procedure, ECT procedure, three main electrodes placement are used in conventional electroconvulsive therapy. ECT was bitemporal, bifrontal, right unilateral. So here most commonly ECT electrodes are placed at bitemporal. So here in this options, option C is the correct answer, bitemporal. Electrode placement determines the geometry of the electric field and can be either non-focal, biotemporal, or more focal, means right unilateral. So here in this option, option C is the correct answer. During the ECT procedure, electrodes placed at temporal. Option C is the correct answer. Next we will move on to question number 80. PEG cells are seen in. Here we can see the PEG cells. We will see here options. Option A, tubes. Option B, vagina. Option C, ovary. Option D, vulva. The literature uses the terms PEG and intercalary is meaning of interchangeable. Therefore, we will refer to this distinct cell type in the fallopian tube epithelium as the PEG cells. Another cell type is called as basal or reverse cell, has been previously observed in fallopian tube. Here the PEG cells is non-ciliated epithelial secretory cell within the uterine tube. These cells represent one of the three epithelial cell types found within the normal fallopian tube epithelium and only make up around 10% of total number of cells. Main function of PEG cells: capacitate spermatozoa, making them capable of fertilizing an ovum in the ampulla. Nutrients secreted by the PEG cells aid in maintenance of spermatozoa and the ovum. So here in these options, option A is the correct answer. PEG cells is seen in fallopian tubes. So here in this option A, tubes is there. Option A, tubes is the correct answer. Here, what is full form of the PEG? PEG, polyethylene glycol. PEG means polyethylene glycol, and PEG means polyethylene gylation of proteins. These two are the abbreviations for the PEG. So here in this option A is the correct answer. PEG cells seen in fallopian tubes. Next we will move on to question number 81. Laparoscopy is best contraindication for the patients with. Here the laparoscopic procedure is best contraindicated for the patients with which of the following condition? We will see here options. Option A, hypertension. Option B, obesity. Option C, COPD. Option D, diabetes. Absolute contraindications for exploratory laparoscopy includes the following condition. Noun or obvious indication for the therapeutic intervention such as perforation, peritonitis, noun intra-abdominal injuries, complications of previous surgery, shock, evacuation, or abdominal wall distances. The most commonly suggested contraindication was hemodynamic instability resulting from the ruptured ectopic pregnancy, means during the pregnancy or in the condition of gynecology. Contraindication for the laparoscopic surgery in gynecology means hemodynamic instability resulting from the ruptured ectopic pregnancy. But here in these options there is no these all things. Laparoscopy is best contraindication for the patient with COPD. Laparoscopic surgery should not be considered a contraindication in patients with COPD. Why means chronic obstructive pulmonary disease. COPD increases the chances of surgical complication such as infection and respiratory crisis. In fact, long-term survival rates for the people with severe COPD who have surgery are lower than the people who do not have COPD. So here in these options, option C, COPD is the contraindication for the laparoscopy. Next we will move on to question number 82. Cannula size used in neonates. We will see here options. Option A, 20 gauge. Option B, 22 gauge. Option C, 24 gauge. Option D, 26 gauge. Small infants frequently arrive in the operating room bearing the scars of multiple previous attempts at venous access, which limit the remaining options. If blood transfusion may required, it is necessary to have at least 22 gauge cannula. In case of blood transfusion, need 22 gauge cannula. The best IV catheter size for the most babies is 24 gauge catheter. Even if the witnessed others trying large gauge such as 22 gauge little babies, they often fail. More importantly, larger gauge IV is typically not needed. Yellow and purple or violet are the commonly used cannula in pediatrics. The sizes is a pediatric IV cannula means such devices are available in various gauges, 16 to 24 gauges, length 25 to 45 mm. The smallest double lumen cannula is 12 French. The most commonly used cannula of this type of size is made up by Origin. The cannula works well, but it can bend and kink, which affects flow. New wire reinforced cannulas were developed by the same company to abundant problems, and currently smallest size is 13 French. The cannula size used in neonates is 24 gauge. In case of blood transfusion, we can use for the 22 gauge cannula. But IV access purpose, we can use the size for the neonates. IV cannula size is 24 gauge. Here in these options, option C is the correct answer here. Next we will move on to question number 83. Vitamin B6, otherwise known as, what is the other name for the vitamin B6? We will see here options. Option A, tocopherol. Option B, pyridoxine. Option C, retinol. Option D, niacin. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin found naturally in many foods as well as added to the foods and supplements. Vitamin B9 is called as folate or folic acid, one of the 8 B vitamins. All B vitamins help to the body convert food into the fuel, which is used to produce energy. These B vitamins, often referred to a B complex vitamin, also help body to use fats and proteins. Vitamin B6 used for important for the normal brain development and for keeping the nervous system and immune system healthy. Food sources of vitamin B6 include poultry, fish, potatoes, chickpeas, bananas and fortified cereals. Here in these options, option A, tocopherol is there. Tocopherol is also known as vitamin E or alpha tocopherol. Other name for the tocopherol is vitamin E. Option C, retinol, otherwise known as vitamin A. It is a fat soluble vitamin. Option D, niacin. Niacin is also known as vitamin B3. So here vitamin B6 is otherwise known as pyridoxine. Option B is the correct answer. Next we will move on to question number 84. What is the carpal tunnel syndrome? What is the carpal tunnel syndrome? We will see here options. Option A, numbness. Option B, weakness. Option C, injury. Option D, dullness. Carpal tunnel syndrome is also called as median nerve compression, a numbness and tingling in the hand or arm caused by the pinched nerve in the wrist. Wrist anatomy, underlying health condition, pattern and use can contribute to carpal tunnel syndrome. What are the causes for the carpal tunnel syndrome? Carpal tunnel syndrome is caused by pressure on the median nerve. The carpal tunnel syndrome is narrow passageway surrounded by the bones and ligaments on the palm side of the hand. When the median nerve is compressed, symptoms can include numbness, tingling and weakness, hand and arms. Carpal tunnel syndrome is a most common neurological disorder that occurs when a median nerve is compressed. So here patient can feel first primary symptom is numbness, weakness, pain in the hands and wrist, fingers may become swollen and useless. So here in these options, option A, numbness is the correct answer. Carpal tunnel syndrome most primary symptom for this condition is numbness. So here in these options, option A is the correct answer. Next we will move on to question number 85. National Cancer Awareness Day is on. National Cancer Awareness Day, we will see here options. Option A, 8th November. Option B, 7th November. Option C, 9th October. Option D, 10th September. National Cancer Awareness Day is celebrated every year on 7th November in India. The World Cancer Day, held every 4th February, is the global uniting initiative led by the Union for International Cancer Control, UICC. Union for International Cancer Control. This is World Cancer Day celebrated on 4th February. But National Cancer Awareness Day is every year on November 7th. Cancer Awareness Day is observed on 7th November in India. National Cancer Awareness Day is observed on November 7th each year in remembrance of Marie Curie's birth. Scientist was born in 1867 and is noted for her brilliant work leading to the development of nuclear energy and radiotherapy for the treatment of cancer. The purpose of National Cancer Awareness Day. Goal of National Cancer Awareness Day is to raise awareness about early detection and avoiding cancer causing lifestyle choices. to develop safe and effective methods to prevent, detect, diagnose, treat and ultimately cure the collection of disease we call cancer. This is the most important aims and purpose for the National Cancer Awareness Day. So here option B, 7th November, National Cancer Awareness Day we are celebrating in India. So here option B is the correct answer. Next we will move on to question number 86. Perceptual disorders are, what are the perceptual disorders from the following? We will see here options. Option A, attention and observation. Option B, orientation and identification. Option C, hallucination and illusion. Option D, none of the above. Many common visual illusions are perceptual. They result from the brain processing of ambiguous or unusual visual information. Other illusions result from after effects of sensory stimulation or stimulation of from the conflicting sensory information. Still others are associated with psychiatric causes. Either perceptual illusion and hallucination. Hallucination or perception not based on sensory input, whereas illusions are a misinterpretation of a correct sensory input. Both phenomena can due to the medication or drug. So visual hallucination can be formed or unformed, means objects or people, light or geometric. So here the perceptual disorders are cognitive disorders characterized by an impaired ability to perceive the nature of objects or concepts through use of the sense organs. These include spatial neglect syndromes, where an individual does not attend to visual, auditory or sensory stimuli presented from the one side of the body. Here both illusions and hallucinations are perceptual disturbances. Hallucinations is a false perception or wrong perception. So here this option C is the correct answer. Perceptual disorders or hallucinations and illusions. Next we will move on to question number 87. Vomiting center is present in the which of the following body part? We will see here options. Option A, midbrain. Option B, medulla. Option C, pons. Option D, spinal cord. Here by two distinct brain centers, the vomiting center and chemoreceptor trigger zone, both located in the medulla oblongata. The vomiting center initiates and controls the act of emesis, which involves a series of contraction of the smooth muscles lining in the digestive tract. This part 3 related to the question number 70. Which part the brain controls the heart means option B, medulla oblongata is the correct answer there. Here which part vomiting center is present in which part of the body means here option B, medulla oblongata, same answer. Same, both are same answer but different questions. The vomiting center present at fourth ventricle of the brain hosts the vomiting center. The floor of the fourth ventricle contains an area called the chemoreceptor trigger zone, CTZ. It is also called as area postrema. When the CTZ chemoreceptor trigger zone is stimulated, vomiting may occur. CTZ chemoreceptor trigger zone, which is located in the hypothalamus of the brain and controls vomitings. MCs means control. Medulla oblongata or medulla is cone-shaped mass which is responsible for autonomic functions such as vomiting and sneezing. Not only vomiting, sneezing also controlled by medulla oblongata. So here in these options, option B is the correct answer. Next we will move on to question number 88. Which of the following instrument is used to measuring the fetal heart sound? The instrument is used for the measuring the fetal heart sounds from the following. We will see here options. Option A, manometer. Option B, pinot stethoscope. Option C, nanometer. Option D, all of the above. A pinot horn is a type of stethoscope used to listen to the heart rate of the fetus during the pregnancy. It is a hollow horn often made of wood or metal about 8 inches or 200 long. A pinot horn is a type of stethoscope used to listen heart rate of the fetus during the pregnancy. It functions similarly to an ear trumpet by amplifying sound. Special stethoscope is used for fetus in womb fetoscope. A fetoscope looks like a stethoscope combined with a horn. It is used to monitor fetal heart rate, but it can also detect heartbeat as early as at 20th week. Which position we can see the heartbeat of the fetus with pinot stethoscope. Back will have been located during the lateral palpation. Midwife will position the pinot stethoscope over the anterior shoulder of the fetus by placing pinot at the right angles to the abdomen and pressing the gently but firmly against the abdomen. The fetal heart can be heard. So here, which of the following instrument used for the measuring a fetal heart sound means here option B, pinot stethoscope. Pinot stethoscope is the correct answer here, option B. Next we will move on to question number 89. Which of the following ions helps in blood clotting? Which ion helps in blood clotting? We will see here options. Option A, phosphorus. Option B, potassium. Option C, calcium. Option D, magnesium. Calcium ions are required for the most steps of coagulation. It is also required for promotion or acceleration of all blood clotting reactions. So, without enough calcium ions in blood would not clot properly. Thrombin enzyme combines with calcium ions from fibrin clot which coagulated the blood. It also works in association with vitamin K to clot the blood. Clotting factor fourth is a calcium ions that plays an important role in all three pathways. Some of clotting factors function as serine protease, specifically factors second, blood clotting factors second, sixth, ninth and 10th. Calcium is a mineral most often associated with healthy bones and teeth, although it is also plays an important role in blood clotting, helping muscles to contract and regulating normal heart rhythms and nerve function. Calcium ions are required for the most steps of coagulation. It also required promotion or all blood clotting reactions. So without enough calcium ions, blood will not clot properly. So here in these options, which of the following ions helps to blood clotting means here option C, calcium is the correct answer here. Next we will move on to question number 90. In case of electrical fire, which of the following should not use? In case of electrical fire happen, should not use which of the following? We will see here options. Option A, use sand. Option B, put water. Option C, use extinguisher. Option D, dry powders. Water, being a good conductor of electricity, can cause electric shock to the person trying to put out the fire caused by any electrical appliance. Hence, fire caused by electrical appliance should not be put off using water. Should never throw water on the electrical fire because water conducts electricity and you could be electrocuted. And if you don't have fire extinguisher, you can use baking soda to extinguish an electrical fire. Which type of extinguisher we can use for the in case of electrical fire? Carbon dioxide CO2 extinguisher we can use in case of electrical fire. Class C fires involve energizing electrical equipment. Extinguisher with a C rating are designed for use with fires involving energizing electrical equipment. Here in case of electrical fire, which of the following should not use means here option B, put water. In case of electrical fire, we have to avoid water. So here option B is the correct answer, except option B we can use sand, use extinguisher, dry powders here. Next we will move on to question number 91. Which of the following body parts has Candyloid joint. From the following body parts has a candyloid joint. So here we will see options. Option A shoulder, option B wrist, option C forearm, option D elbow. The wrist joint, also referred to as the radiocarpal joint, is a condyloid synovial joint of the distal upper limb that connects and serves as a transition point between the forearm and hand. A condyloid joint is a modified ball and socket joint that allows for flexion, extension, abduction and adduction movements. In exam we will get like this also. How many condyloid joints are present in the body? 22 condyloid joints are present in the human body. They are found at the base of each finger but not the thumb. Each finger but not the thumb. At the base of the each toe, in the ankles and wrist. These joints allow flexion, extension, abduction, adduction and circumduction movements. Other name for the condyloid joint are condylar, ellipsoidal or bicondylar. These all are the other name for the condyle. So here, which of the following body parts condyloid joint has a condyloid joint? We will see here options. Option B wrist is the correct answer here. Wrist is having the body parts has a condyloid part. Wrist is having a condyloid joint. So here option B is the correct answer. Next we will move on to question number 92. The painless vaginal bleeding during the period of 20 weeks, it may indicates to. Here the vaginal bleeding present at the time of 20 weeks of gestational age. It is painless vaginal bleeding during the period of 20 weeks. What can indicate to? We will see here option A normal bleeding, option B placenta previa, option C ruptured membranes, option D one of the normal sign. Placenta previa is a cause of bleeding late in pregnancy. This is after about 20 weeks. It causes bleeding because placenta is close to or covers the cervix. Bleeding with placenta previa is painless. It is most cases not serious. It can happen in the first 20 weeks for the different reasons. It can be the result of something serious or non-serious. Continued bleeding throughout the pregnancy is not common. In case of bleeding is occurred at 20 weeks, it is not a miscarriage. Bleeding does not usually mean a woman going into the labor or having a miscarriage. This is not a meaning for the bleeding at the 20 weeks of duration. Here, painless vaginal bleeding during the period of 20 weeks may indicates to placenta previa. Here in these options, option B is the correct answer, placenta previa. Next, we will move on to question number 93. What is the normal blood pH between the? We will see here options. Option A 7.35 and 7.45. Option B 7.45 and 8.15. Option C 7.14 and 7.40. Option D none of the above. In the absence of pathological states, the pH was human body ranges between the 7.35 and 7. The normal pH level of the healthy person ranges from 7.35 to 7.45. It is slightly basic or alkaline. The normal arterial blood pH range is between 7.36 and 7.44. What is the normal blood pH between the from the following options means? Option A 7.35 and 7.45 is the normal blood pH levels. So here in these options, option A is the correct answer. Next we will move on to question number 94. Crista galli is a small crest on which bone? The crista galli is a small crest on which bone? We will see here options. Option A maxilla, option B frontal, option C ethmoid, option D mandible. The crista galli is a thick midline smooth triangular process arising from the superior surface of the ethmoid bone and protecting into the anterior cranial fossa. What does the name of cresta galli means? Cresta of the rooster. Roughly translated, cresta galli is Latin for the crest of the roast. What passes through crista galli means the olfactory nerve originates on the caudal surface of the olfactory bulb and crosses the cribriform plate of the ethmoid bone from one part of the crista galli process to the other in order to reach the olfactory region of the nasal cavity. Here the crista galli is small crest on the bone means here option C. Ethmoid bone is the correct answer, option C. Next we will move on to question number 95. What is the cause of death in burn victims? What is the major cause of the burn victim? We will see here options. Option A, fluid loss. Option B, hypokalemia. Option C, urinary incontinence. Option D, sepsis. In several cases, one or more organ systems are failed. In the worst cases, blood pressure drops and heart weakness, and the patient spirals towards septic shock. Once this happens, multiple organs, lungs, kidneys, liver may quickly fail and patient can die. Three common causes: bacterial infection, of one most common cause is sepsis. Fungal parasitic infection, viral infection, also potential sepsis for the causes. Sepsis is the cause of death in burn victim. Sepsis occurs in response to an infection. When sepsis is not recognized early and managed promptly, it can lead to septic shock, multiple organ failure, and it leads to death. What is the cause of death in burn victim is sepsis. Sepsis is the most major common cause for the death of a burn victim. So here option D is the correct answer. Next we will move on to question number 96. In Klinefelter syndrome can see number of chromosomes. How many chromosomes are present in the Klinefelter syndrome? We will see here options. Option A 48, option B 47, option C 46, option D 49. Klinefelter syndrome is a genetic condition that results when a boy is born with an extra copy of X chromosome. Usually female baby has 2 X chromosomes and a male has 1 X and 1 Y. But in Klinefelter syndrome, a boy is born with extra copy of X chromosome, and X chromosome is not a female chromosome and is present in everyone. Most often, boys and men with the Klinefelter syndrome have the usual X and Y chromosomes plus 1 extra X chromosome for a total of 47 chromosomes. Klinefelter syndrome is a chromosomal condition in boys and men that can affect physical and intellectual development. So here, Klinefelter syndrome is common genetical condition. In here, the chromosome number was 47. So here in this option, option B is the correct answer. In Klinefelter syndrome can see in the number of chromosomes means here option B 47 chromosomes. So here option B is the correct answer. Next we will move on to question number 97. Next we will move on to question number 97. Buck's extension belongs to which method of traction? Buck's extension belongs to which method of the traction? We will see here options. Option A skin, option B muscles, option C bones, option D none of the above. Buck's traction is a type of physical therapy practice commonly used for the management of femoral fractures. The goals to maintain Buck's traction position are to restore normal bone alignment and length, lessen or eliminate muscular spasm and reduce pressure on the nerves. Buck's traction is a type of physical therapy practice commonly used for the management of the femoral fractures. Buck's traction. Buck's skin traction is widely used in the lower limb for the femoral fractures, lower backache, and hip fractures. Skin traction rarely reduces the fracture but reduces pain and maintains length in fractures. Buck's traction is type of skin traction that widely used broken femurs and hips as well as fractures in the socket portion of the ball and socket hip joints. So here Buck's extension belongs to the method of traction is skin traction. Option A is the correct answer here. Next we will move on to question number 98. INC established in. INC established in means Indian Nursing Council. We will see here options. Option E 1819, option B 1947, option C 1847, option D 1957. Genesis and inception of the Indian Nursing Council. The Indian Nursing Council was constituted in the year of 1947. Under the Indian Nursing Council Act, the council has been functioning since then as an autonomous body under the Union Ministry of Health and Family Welfare. Rapid administration or infusion of insulin cause. What is the cause for the INC is an autonomous body under the Government of India, Ministry of Health and Family Welfare was constituted by the central government under the Section 3 of Indian Nursing Council Act 1947 of Parliament in the order to establish a uniform standard of training for the nurses and midwives. So here INC Indian Nursing Council established in the year of option B 1947 is the correct answer here. Next we will move on to question number 99. Rapid administration or infusion of insulin cause. We will see here options. Option A hyperkalemia, option B hyponatremia, option C hypokalemia, option D hypercalcemia. During the insulin treatment, plasma potassium levels will be invariably fall, possibly leading to the hypokalemia. Recent studies have shown that the incidence of hypokalemia in DKA may be lower than 4%, appearing in the most cases only after the insulin administration. After insulin treatment is initiated, potassium shifts intracellularly and serum levels are declined. A rapid infusion of insulin causes the hypokalemia means exogenous insulin can induce mild hypokalemia because it promotes the entry of potassium into skeletal muscles and hepatic cells by increasing the activity of the sodium, potassium and ATP as pump. So here the rapid administration or infusion of insulin is caused to the hypokalemia. So here option C is the correct answer. Next we will move on to question number 100. This is last question in this part 3 video related to the third set of model paper. Question number 100. The term of thoracentesis is refers to the term was thoracentesis means. We will see here options. Option A inflammation of the thorax and abdomen. Option B removal of fluid from the pleural cavity. Option C puncture into the pleural cavity for removing the fluid or air. Option D none of the above. Thoracentesis is a procedure that is performed to remove fluid from the thoracic cavity. This can be done for the both diagnostic and therapeutic purposes. A potential space exists in the left and right side of the chest cavity between the inner chest wall and lung is called as thorax. Thoracentesis is a procedure that a provider uses to drain extra fluid from around the lungs or pleural space with a needle. It used to test fluid for infection or other illnesses and to relieve chest pressure that makes it tough to breathe. So here the term thoracentesis is option C puncture into the pleural cavity for removing fluid or air is the correct answer here. What is meant by thoracentesis? The term thoracentesis means removal of fluid from the pleural cavity through a needle inserted between the ribs. So here puncture into the pleural cavity for the removing fluid or air. So here in these options, option C is the correct answer here. This is last question in this part 3 video. This is third set of model paper. Till now we finished 3 sets of model paper related to the staff nurse 2023. In previously we finished almost 90% of subjects also. Next upcoming classes we will discuss related to the MHSRB staff nurse online mock test provided by the TS MHSRB. I will explain in detail about mock test 80 questions. Thank you so much for watching my video. Anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification, and please share the video to your friends. Give a like and share your opinion in comment section. Stay tuned friends. Thank you.